Let's talk about pain with ovulation, or MITTELSCHMERZ. I'm Dr. Jessica Reinick, an OBGYN and reproductive endocrinology and infertility specialist, and I'm here today to talk about ovulation pain. If you're someone who has pain in the middle of your cycle, you know what I'm talking about, and that MITTELSCHMERZ, middle pain in German, is actually pain from ovulation, or potentially pain from ovulation. So ovulation occurs after your hormones prompt your ovary to grow a follicle that contains an egg, and that follicle is brought to the surface of the ovary, and then at time of ovulation it ruptures. Ovulation is actually an extremely violent event at the level of the ovary. It's very, very small, however, it can cause a lot of discomfort for some people. And that's because, first of all, the follicle can stretch the outer part of the ovary, and so sometimes people might have that stretching sort of pain and discomfort as the ovary is growing and that follicle is pushing to release the egg. Another way that it can cause pain is that the egg literally has to erupt from the surface of the ovary. That breaks through the wall of the ovary, and that can cause a lot of bleeding because there's a lot of blood vessels on the surface of the ovary, and as the fluid bursts out, the blood vessels can be broken, and both the fluid and the bleeding can enter the pelvis, and that can cause inflammation and pain. So when we think about ovulation pain, it's probably related to one of those two things, either the stretching of the ovary or the actual violent releasing of the eggs that might cause bleeding and thus irritation of the pelvic organs.